Yeah, I'm a physician assistant. I work in the emergency department, and I travel to different emergency departments around the country that are short-staffed or aren't able to meet their scheduling needs for one reason or another. I've been doing this full-time for about 2 years. I do have some regular hospitals that I go to, but oftentimes, I may do just a couple weeks at a hospital while they get their scheduling needs met, or while they have somebody who's on vacation and I can just fill in. So yes, this has been my full-time job for 2 years, is traveling to different EDs, and it's a very nice opportunity.
Yeah, I bet. So there's all different hospitals. Sometimes they just need more staff, and there's companies out there, staffing agencies that staff physician assistants like you to fill in and state to state, and
Yep.
to make sure their hospital is providing the best care possible. I know Affinity takes care of our clients in the homes, and in normal times we have the ability to take some of our clients out into the community, but obviously now that can't happen. Everyone is homebound currently right now, so they're trying to make sure that we keep all of our clients and our community at home safe. Can you give us some tips of for family members that have their loved ones at home to stay healthy?
Yeah, sure. And Chris, I think what you guys are doing is fantastic. COVID or no COVID, it's so important to be able to offer that home care to people who are homebound and vulnerable populations, especially right now. For family members who do have loved ones that maybe are homebound, they can't see as much right now, I think one of the big things is to use technology. Be able to offer all people involved the ability to see each other and communicate safely without having to be in the same space with each other. For the family members and for the general populace, some of the really important things is plenty of fluids, water throughout the day, a good healthy diet, really watching people's sugars right now is important. I call sugar a sleeping pill for the immune system. Really eating plenty of vegetables, washing your hands. Hand washing is critical right now, as we all know, and wearing a mask anytime you leave the house. And that mask is more to protect everyone else and to keep your germs contained. So the idea is if everyone is keeping their own germs contained, then inherently we're all being better protected. And I think right now what we really need to think about is, what can I do to protect others? And I think that that's something that's on the forefront of a lot of your family's minds, because they have somebody who is more vulnerable.
A lot of our family members and our loved ones that need help, they're going to the grocery store and they still have to pick up their prescriptions and all that. How do you feel about that?
I think that there's an element. We have to do what we need to do to stay alive. Clearly, we have to eat. We have to take our prescriptions. Minimizing the amount of trips that you can make. So really planning ahead, and it's a lot more fiscally responsible as well to plan out your meals and buy exactly what you need. Get your prescriptions while you're there. Don't make multiple runs because, oh, I forgot this. Oh, I forgot that. Wearing your mask anytime you leave the house. And again, we really need to focus on not how do I keep me safe, but what do I do to keep everyone else safe? So right now, the best way to protect yourself is for everybody to protect everyone else, and you inherently will be protected.
I agree. Now, signs and symptoms. I know that some of our clients that they struggle if they should go to the hospital or not. So what are some signs that they should call their doctor?
So a lot of the hospitals and a lot of the doctor's offices have specific numbers that you can call and talk to a triage personnel, and they can help you sort out your personal symptoms.
Yeah.
Really, what I would say is, if you are having a medical emergency, and not just something that may be related to COVID, but anything where you're having difficulty breathing, you're having significant chest pain, you are not able to take care of yourself and you need somebody to come in and intervene and help you, potentially bring you into the hospital where we can take care of you better. And it's not just something that you can take care of yourself at home. You know, a laceration that needs sutures, you need to come to the hospital. We need to be able to take care of you. But definitely calling that triage line is super important. Keeping yourself really well hydrated at home. You know, the symptoms are across the board, they run the gamut. So it's really hard. You know, we're seeing typically fevers, sore throats, cough, difficulty breathing. Those are some hot ticket numbers, but we're seeing this in a lot of different ways. We're also seeing people who have other infections that also have COVID, and so sometimes we have more than one thing going on.
Sure.
So my advice is definitely call the triage line, contact your doctor, potentially going to an urgent care if it's open, if it's not, you know, significantly dire. But if you're having respiratory distress, if you're having a hard time breathing, if you're having chest pain, if you're having any type of extreme pain in your body that is new, that is different than your normal, then yes, come see us. If you're having your usual back pain, but it's a little bit worse, this may not be the time to come in.
Other alternatives of going into the hospital?
Yeah, actually, you brought up a really good point. One of the things that we're doing more and more is called telemedicine. So we're able to use technology, tablets, phones, to be able to have a visual appointment, but not actually in person. So it's a virtual appointment, if you will. And it's a fantastic way because there actually are quite a few things in medicine that we can handle by looking at somebody and hearing their story. We can put some pieces together and we can usually at least start a treatment plan and see how it progresses over the next few days. So I think that that's a fabulous alternative right now.
One last question. What is the most important thing for people to remember when thinking about protecting people? Like,
some of the most important things are, again, to approach this from what can I do to protect everyone else? Because if we all are protecting everyone else, then you're inherently protected. So masks, good hand washing, drinking plenty of fluids, keeping the immune system strong. Melatonin, which is a natural hormone that we get that is part of the sleep cycle. Really important for the immune system. So sleeping is incredibly important right now. Vitamin D is a great support for the immune system. So some of us in the winter climates where we don't get as much sunlight, sometimes a vitamin D supplement can be beneficial. I'm not necessarily anyone's personal doctor, so this is just a general overview, but you know, so vitamin D and getting plenty of sleep and eating well and washing your hands and wearing a mask if you go outside. Wearing a mask if you go outside is one of the most important things I think we can all be doing for each other. And call the doctor's office, call the ER if you need to, talk to the triage people and let them help you sort it out if you need to come in or if there's another way that we can take care of you.
That's great. Thank you, Cara, for spending time with us today. We appreciate all your insight. And
no problem, Chris. Thank you so much, Chris, for what you do. I think that your job is critically important, taking care of people who are not able to get out into the community and making sure that they still have, you know, the human contact and their needs being met. So thank you.
Yeah, you're most welcome. And what hospital are you going to after this?
I start work in Kentucky on Sunday.
Again, thank you for your time. We hope you have a great stay and stay healthy out there.
Thanks. You too, Chris. Take care.